Hi, I'm Melissa, a breastfeeding peer supporter from Solihull Infant Feeding Team. You're probably here because you're pregnant and considering your options for feeding your baby. No matter how your baby is fed, it should be responsive to their needs and as part of building a close and loving relationship between you. Responding to your baby's needs for nutrition, but also for closeness and comfort, will help their brains to grow. But you can also begin to build a connection with your baby during pregnancy. You, your partner and other children can get involved. You can notice when they move and respond to them. You can talk to your baby, sing or stroke your bump. This way, baby will already know the sound of your voice, and when they are born and placed in skin-to-skin contact on your chest, they will already know you and will feel safe. Your baby has spent around 9 months curled up, secure, contained and warm, listening to your body. The world can seem bright, loud and confusing for a baby, but being in skin-to-skin contact on your chest is the next best thing to being back in your tummy. This will help them adjust to the outside world, but it's also useful to use at any time you and your baby need to relax, as it is so comforting and calming due to the hormones that are released. Here's some more information about skin to skin. It helps regulate baby's breathing and heart rate, helps them adjust to being born, helps regulate baby's temperature, stimulates digestion and interest in feeding, enables colonisation of the baby's skin with the mother's friendly bacteria, which helps to provide protection against infection, stimulates the release of hormones to support breastfeeding and mothering, and it will also help to boost your milk supply. During pregnancy, you may have noticed that your breasts have become fuller. The areola, the skin around the nipple, starts to get darker. Inside, lots of preparation is underway for breastfeeding, and you can produce the first milk, called colostrum, from around 16 weeks of pregnancy. However, you don't get a full milk supply as hormones released from your placenta prevent this. As soon as baby is born and the placenta is delivered, those hormone levels drop, which alongside hormonal stimulation from your baby sucking, milk is then made. It takes a few days for your milk to come in as it starts to change from colostrum, but colostrum is perfect for your baby. It is in small quantities and super concentrated with everything that your baby needs. It's really high in protective immune factors, giving vital antibodies to your baby. Your breast milk is a living fluid and it's personalised just for your baby. It contains exactly what they need at that time. It has thousands of components that just cannot be replicated, including antibodies, stem cells and antiviral properties which will protect your baby. Babies who do not receive breast milk have an increased chance of hospitalisation due to diarrhoea and vomiting, chest infections, ear infections, constipation, eczema and becoming obese, which it makes it more likely that they'll develop type 2 diabetes and other illnesses in later life. Breastfeeding is also good for mothers too. It lowers your risk of getting breast and ovarian cancer. It burns around 500 extra calories a day. It saves you so much money, and remember, the longer you breastfeed for, the more you and your baby will benefit. To ensure that breastfeeding gets off to a good start, have baby in skin-to-skin contact for at least the first hour or until they feed. They may want a short rest and not feed immediately, but they're usually interested in feeding in that golden hour after birth. A biological nurturing or laid-back feeding position can work well immediately after birth or any time that you and your baby want to get comfy and relax whilst feeding. To ensure that feeding goes well, baby gets enough milk and prevents any soreness or damage to you, ensure you're holding your baby in a comfortable position, enabling them to attach to the breast well. You can feed baby in any position that works for you. Just remember these basic principles. Keep baby nice and close and tucked into you, keeping their head free so that they can tip their head back. Support them round the back and their shoulders, keeping their head and body in a straight line so that they're facing the breast, and starting with the nose level with the nipple. When baby can feel the nipple under their nose, they will start rooting, opening their mouth wide and tilting their head backwards. Move the shoulders quickly in towards the breast so that the chin is touching the breast first and the bottom lip is well away from the base of the nipple. The nipple should tuck in just under the top lip and aiming towards the roof of the mouth. Here you can see an example of good attachment. Baby's chin is embedded into the breast. Cheeks are full and rounded, not sucking in like dimples. You should also see fast sucks initially, which then turn into slower, deeper sucks. Swallows can be heard when your milk comes in at around day 3 to 5. Baby should be content and settled on the breast, and it shouldn't hurt you. Breastfeeding is part of mothering. It's not just nutrition for your baby. They will come to the breast for comfort, warmth, a hug and a drink. It's where your baby will feel most secure and safe, and it's natural for them to want to be close to you, hearing your heartbeat. Breastfeeding isn't just about your baby's needs, it works both ways. You can also offer a feed if your breasts feel full, you want to relax or cuddle your baby. You can never overfeed a breastfed baby. Your baby obviously cannot speak yet, so they will express how they're feeling through body movements, small sounds and crying. For example, early hunger cues start with baby stirring, opening their mouth and turning their head side to side. They then start to become more active, maybe moving their arms, kicking their legs or putting their hand towards their mouth. Late feeding cues are when your baby is crying or agitated, and as you can imagine, it's much easier to feed a baby when they're showing you those earlier feeding cues than if they're crying. You're going to need to calm them down first and then feed them. Your baby should stay close to you in the same room, or you can carry them in a sling, which means it's much easier to respond quickly, comfort them and feed them following those early feeding cues. When you respond to your baby, it helps their brain to grow, it keeps them feeling safe and secure and helps build your relationship with them. You cannot spoil a baby with love or too many cuddles. A baby that knows its parents will respond to them gives them a secure base and helps them to have healthier relationships throughout their life. We used to think that babies only interacted with us when we started that interaction. We now know that even immediately after birth, your baby will want to communicate with you, so look out for them gazing at you, following the sound of your voice. As they get older, they'll start copying your smiles, which is so rewarding. Your baby will love it when you interact with them, and this is important for their brain development and general happiness as they grow. So as breastfeeding meets so many of your baby's needs, we will expect that babies will want to feed frequently, around about 8 to 12 times in 24 hours and anything between 5 and 40 minutes. Babies will want to wake at night time, as this is when prolactin, your milk making hormone, is highest. But really helpfully, hormones in your breast milk will also help your baby to fall back to sleep and help you to get back to sleep quicker too. Night waking is normal in all babies, but research shows that breastfeeding mothers get more sleep for this reason. Frequent night waking is also a protective factor against SIDS, and it's normal for babies to wake at least 2 to 3 times a night until they're at least 18 months old. Remember, breastfeeding shouldn't be painful. It may feel unusual or uncomfortable for a few seconds, but any pain that continues after around the first 10 to 30 seconds means that something isn't right and we might need to make some adjustments. Getting support with this early on is vital to the success of breastfeeding. If you want to learn more about hand expressing, cluster feeding, growth spurts or any other positions for breastfeeding, you can find out all of this and more in our new videos coming soon, or have a look in our bio for links to our social media, Facebook, Instagram and Twitter pages.